you can now help us understand is that the main hospital, they will be told, well, this is a diagnosis, and after that, this is the prescription for treatment that you would then need to get. But the pharmacy within the hospital does not have some of those drugs. But for some miracle, the chemists and pharmacies in the vicinity of the hospital have these drugs. So can you see why it's a lucrative business? And it is said, rumor has it, that a lot of these pharmacies and chemists belong to staff who work in the hospital.
Precisely. I mean, I could not have put it any better. There is also very intentional, very deliberate sabotage by senior doctors and managers in public hospitals to sabotage the hospitals that they are supposed to give life to ensure that their patients are well taken care of and they get sufficient drugs. When you go to private hospitals and mission hospitals, and I'm privileged to work as a director in one of them, you would never find private chemists within a radius of 500 meters. They would never be there because they are straight. They focus on the narrow path. Treat your angels, your patients well. Give them drugs if the drugs are within the pharmacy. If you are struggling because you're still waiting for SHA, you're waiting for Dr. Masi Mwangangi to disperse your money, you refer the patient to whichever chemist. But when you go to public hospitals, you might find that the doctor is there, and public hospitals have fairly good medics, from nurses to clinical officers and doctors. It's only that they run private clinics at the same time. They will give you a prescription for a drug which is not within the hospital pharmacy, but they would give you a direct direction. They'll direct you to certain chemists, and certainly, as surely as the sun rises from the east, you will find the drugs in the chemist you've been referred to. We need to close those chemists and pharmacies around public hospitals. And once that is done, we should ensure that we have sufficient drugs in hospitals.
In the hospital?
Yes, we should have sufficient drugs in the hospitals, because if they can be found within a radius of 500 meters...
Surely they can be found in the hospital.
Yes, why can't